I talk to a lot of people who are looking for airway orthodontics. It's part of how I make my living off JawHacks. I offer one-on-one chats. I talk to maybe, a handful of people a week. Very rarely do I speak to someone who says, I'm in too much pain in my joints to go through treatment. I can't handle the treatment. I can't imagine having an expander in my mouth because it's going to be too painful. So, but you're saying that patients, they really need this support during expansion, or do all patients need this support even if they don't realize they need it, that their joint is at risk of severe degradation every day they let it go on without support?
Some of these patients, very quietly, the joint can be melt down, all right, with no pain. They don't notice, like this patient that I'm showing right now. See that how much open bite? When you see this, suspect that the condyle is melting down. And I show you his condyle. Sometimes it's painful, sometimes in no pain. But at the same time, back to your question, Ron, everybody needs it? No. That's why we take very elaborate records. We spend 1.5 to 2 hours to take the records, condyles. So the size of the condyles are stable. There is no damage to the disc, or is a stable damage. All right, the top of the bone is not osteoarthritis, is melting down. So Ron, if the patient comes and say that I have narrow palate and I don't like it, but then we know that doesn't have a sleep apnea, the joints are stable, then doesn't need to go through, having the ApnoTX, all right?
Mm-hmm.
Not everybody needs this appliance if they don't have a joint damage, if they don't have pain, because the other things about the appliance, ApnoTX, is managing the pain. Can they live with the pain? If the patient said that I'm a zombie during the day, either they need to wear the CPAP or something that does like CPAP, like ApnoTX or ASA appliance. And one more thing, Ron, this patient, they have narrow palate, okay? Look at this. This patient has very narrow palate right now and doesn't have space for his tongue. I want you to imagine that if I put my expander on this mouth, what do you think that is going to happen to the airway of this patient?
It's going to become non-existent at that point.
Yes. So it's not just matter of this stage of the treatment. So when we put the appliance, we need to test them again with the appliance in their mouth. And if they survive and they don't have a sleep apnea, sure, they don't need the ApnoTX. So this patient has this problem, meaning that he has different type of open bite. Again, is damaging the joint. He has a lot of clicking and popping. So when we look at his chief complaint, has mild sleep apnea, is excessively sleepy during the day, remember, and cannot tolerate CPAP, and jaw clicking, popping, nocturnal teeth grinding. Run, pay attention to this. Sleepy while driving. Do you know how dangerous it is? We
I
cannot
do know
leave
how
them.
dangerous that is.
Yeah,
That's
you
a that's
cannot
a
leave them like this.
He
Go ahead.
could end up committing vehicular homicide or vehicular suicide.
Exactly. So that's why the airway of this patient, it can get worse when we put this bulky appliance in them. So either they need to wear the CPAP or some kind of appliance that is going to support the airway. We need to be sure that the airway is, stable during this period of time. So Ron, I want to show you this X-ray of this patient. So just to familiarize you, these are the joints, the condyles they call. This is on each side. This is I'm pointing to them from the front, and then pointing them when we look at them from the side. This is spread, the lower jaw is spread on one surface, panoramic X-rays. So I want you to pay attention to this. Look at this right condyle, all right? And let's go back and let me explain. This is condyle, this is the lower jaw, and then when we put it on one surface, this is the way how it looks like. There should be this image. We should have symmetry between one side to the other side of the jaw. We should have condyles that fill up the socket. Look at the right side condyle, right? It is not the healthiest condyle, but look at the shape of this and look at the left side condyle. Look at this. This is the melted away condyle. Look at this and look at the other side. See how much smaller is this? This is a
Wow.
melting down condyle. This is the active side of osteoarthritis. All right. Both sides are shrinking inside osteoarthrosis. But this side is active side of the osteoarthritis. This area is called sclerotic bone. See this here?
Mm-hmm.
This is the
Mm-hmm.
dying bone
It's a
that
cup. It looks,
gradually
it's
slough
cupping.
off. Yes, top of the bone. The
Mm.
area that every night is under compression.
Mm.
So that should be, rehabilitated. It means that when we go through this, the ApnoTX is going to help. Look at this, the top of this bone here on the right side of the face. See, there is a thin layer of the bone, but here we don't have that thin layer of the bone, which is called cortex or surface of the bone. We need to bring it back when we are doing this. So that's another concept of using ApnoTX or any other appliance that can do the same thing, work with with the Invisalign or expanders to recorticate the joint. So these are the area of the bone melting down.
So you have MSE and you're expanding, but you also have the Apno TX getting your joints healthy, opening up your airway for 1 or 2 years during your treatment. You're giving your joint a 2 year healing period to catch up. Instead of 2 years going in the wrong direction with the joint health, it's 2 years going in the right direction.
Absolutely right. So just imagine, Ron, that patient goes through this process and have been through this process, like patient that I just showed you right now. So this is the condyle. If the disc is not in place, remember
Mm-hmm.
we said that the bone is going to be traumatized, right?
Mm.
So if the disc, which is the shock absorber, is not in place, the bone is going to get traumatized. In some patients, they are going to be worse. Some they are less effective. The older the patient, the more susceptible, especially female patient, they are more susceptible. So bone goes through what is called osteoarthrosis. I'm going to back it up a little bit. Hold on. Here. The disc is displaced.
Mm.
That's why patients that they have knee arthritis, the disc is damaged, they go through osteoarthritis of the knee. They
Mm.
can lose their height.
Mm.
So the bone gets shorter. So look at this. How the mandible, the jaw move back, how the airway gets smaller.
Mm-hmm.
Do you see this?
Mm-hmm. Mm-hmm.
We need to prevent it.
It's a downward
Not
spiral.
yeah.
The poor
So
get poorer.
yes, I emphasize that not every patient is going to go through this severe case, but at the same time, there are population of patients that are susceptible. So if we can, and do you know what? CPAP is fine. Give them the CPAP. CPAP can reduce the bruxism and can reduce the damage to the joint if they don't brux, or appliance that not only like CPAP is going to make them breathe and not bruxism, help actually recordicate the joint and stabilize it. So makes sense
Yeah, of
before I
course it
take off
makes
from this
sense.
video.
Of course.
Yeah. So now that's why he's going to wear the appliance. And this case, with Invisalign, we're preparing his arches. We are going to create a space between his lower teeth because both upper and lower jaw, they are narrow. I cannot elaborate too much on this because of time. So we expand the lower jaw, we expand the upper jaw of the patient. The lower jaw is going to be DAME, distraction assisted mandibular expansion. Still, he's wearing the appliance. See this? He's
Mm-hmm.
wearing the appliance during this stage with this appliance. So Ron, just imagine that upper expander in MSE or our DAME, we call it, how complex makes the airway. Just imagine that we add the lower expander to it. The airway is going to be none left from the airway. So that's why they need to breathe when we are stabilizing the joint. So the advantage is that when we expand the nasal cavity, if we expand the mandible, we can expand the upper jaw even more and nasal cavity even more. If we do MSE and we are going to expand the maxilla, is great. But if we expand the mandible, we can double the expansion of the upper and lower jaw.